Lec.9, the heart. This lecture is divided into two parts. Okay. We'll begin by talking about the pulmonary and systemic circuit. You can think of your heart as having two side-by-side pumps. The right pump propels blood into the pulmonary circuit. This is where that deoxygenated blood gets replenished with oxygen. And then that oxygen, which is now oxygen rich, gets returned to the left heart. Your left heart, this left pump, now contracts and propels the blood into the systemic circuit. At the systemic circuit, your tissues use up the oxygen and then generates it and returns this now oxygen poor but CO2 rich blood, which is then carried back to the right pump. Okay. So you can think of these two circuits as in series with one another. Let's take a look at the location and orientation of your heart inside the thoracic cavity. Your heart is located inside the mediastinum. Recall that the mediastinum is the space between your two lungs. Okay. That specific space that contains the heart is known as the pericardial cavity, also known as pericardial space. As you can see here, the heart sits on top of the diaphragm. Now the heart has an apex and a base. Okay. Contrary to what you may think about where the base is, the base of the heart is probably better described as its posterior or superior surface. Okay, so it's the most superior surface of the heart. And it's thought to be named that way because it resembles the base of a pyramid, which extends obliquely to the left toward the apex of your heart. The apex of your heart, which is on the opposite end of the base, points toward the left hip. And here you see the posterior view of your heart. From the posterior view, you can see the base of your heart, which contains the left atrium, as well as the great vessels. So the great vessels of the heart are just vessels that directly enter or exit out of the heart. And those include the superior vena cava, the inferior vena cava, the aorta, the pulmonary trunk, as well as the pulmonary veins. So all those stem from the base of the heart. Your heart is tilted in such a way that the right heart is deflected to where the anterior and the left heart is deflected posteriorly. Okay. And because of this, the most anterior chamber is the right ventricle and the most posterior chamber is the left atrium. Here you can see that the left atrium is essentially right in front of what will be here is the esophagus, but also the aorta. Okay, and this is your vertebral column. Your right ventricle is the chamber closest to your sternum, which will be located here. So if someone were to suffer from a stabbing wound, they get stabbed right in the chest, it's most likely to pierce through the right ventricle because of this orientation of the heart. Now let's take a look at the various structures of the heart. First, the coverings surrounding the heart. If you were to open someone's thoracic cavity, you're going to see this layer known as the fibrous pericardium. Okay. And if you look closer at this first image, you'll see that the fibrous pericardium adheres right to the parietal layer of the serous pericardium. Recall earlier in the semester we talked about the serous membranes, which come in two layers. The parietal, which is the more external layer, and the visceral, which is the more internal layer. And so we have the same thing going on here. The two layers are continuous with one another. The parietal layer of your serous pericardium is actually directly attached to the fibrous pericardium. So one's just the outer surface, the other is the inner surface. They're just two separate layers, but they are adhered together. This visceral layer of your serous pericardium is also known by the name of epicardium. Okay. And so it's continuous with the parietal layer of serous pericardium. Between them is a space known as the pericardial space or pericardial cavity. Inside the space, you'll usually find a thin layer of fluid called the pericardial fluid. And that fluid has an important function of help lubricating the surface and reducing friction when your heart is contracting. Okay. So in this image, you see the fibrous pericardium intact around the heart. If you are to peel that away, this is the inner surface of that layer. This is now the parietal serous pericardium. Okay. Now, sitting right on top of the heart is the visceral serous pericardium, also known as epicardium. Okay. If we are to look at the layers of the heart itself, the outermost layer is the visceral serous pericardium, also known by the name of epicardium. On the test, you can write either. So that's the outermost layer. Deep to that is this thick layer known as myocardium. And this is the cardiac muscle that's responsible for heart contraction. And in the deepest layer lines the heart chamber, and that is known as the endocardium. This is a very thin layer that is continuous with endothelium of your blood vessels. Okay. Now we're going to talk about the heart chambers. And I'll show you the same thing in complete anatomy in just a few minutes. This is a lateral view from the right side of the heart, showing the right atrium. Here you can see a few features of the right atrium. Should let me pull up complete anatomy right now. Okay. So this is, you can see this is your heart from the front. As we mentioned earlier, the most anterior chamber is the right ventricle. So that's this one. Okay, so let's take a look from the right lateral view. And this is going to be your right atrium. If we were to take away the wall and look inside, let's see if we could do that. Here we go. Okay. Notice a few features of the right atrium. On the interior wall of the right atrium, notice the ridges. These are the ridges of the pectinate muscles. So these are the pectinate muscles. Okay, and this protruding part is known as the auricle, the right auricle. Okay. And this region here, it's actually a wall that separates the right atrium from the left atrium. It's known as the interatrial septum. This is something we're going to talk about a few slides from now. But on the interatrial septum, you'll notice in depression, this is known as the fossa ovalis. This is a remnant of what used to be a passage between the right and left atria. So it used to be called the foramen ovale. Yeah, foramen ovale is the term when there's a hole here. But after birth, this closes off and becomes the fossa ovalis. Notice that the right atrium receives three sources of blood. One is the superior vena cava coming from above. Okay, so it drinks blood from your tissues above the diaphragm. Whereas tissues below the diaphragm, the blood drains through the inferior vena cava into the right atrium. So we got superior vena cava, SVC, inferior vena cava, IVC, and then the third source, as you can see in the hole here, this is the coronary circulation. So this is the coronary sinus. Coronary sinus is deoxygenated blood returning from the heart itself. Okay, and this is something we're going to talk at the end of today's lecture. So those are the three sources: SVC, the IVC, and the coronary sinus. Okay, so this is a posterior view of your heart. Notice that directly on the posterior side of your heart, okay, looking at the base of the heart, this is the left atrium. Okay, as I mentioned earlier in this lecture, the left atrium is the most posterior chamber. Okay. Now we take away part of the wall and look inside. Extending a bit anteriorly, but toward the left, this is the left auricle. So it's so you can see it as like a extension of the left atrium. Okay, it helps increases the atrial volume. Okay. Inside the left atrium, you'll notice that the pectinate muscle is also present, but here it's only present inside the left auricle. Okay. So the left atrium receives oxygenated blood from the lungs through the four pulmonary veins. Okay. So these are your two pulmonary pulmonary veins, right pulmonary veins, and these are your two left pulmonary veins. Okay. These ones depicted in blue, as we'll see soon, these are even though they're blue, but they're actually arteries. And that's because arteries, by definition, pump blood away from the heart, whereas veins return blood to the heart. Okay. We're not looking at the most anterior chamber, which is the right ventricle. We're going to take a piece off its wall, just look at it inside. So this is your right ventricle. Notice that it's got two valves, one that separates it from the right atrium, and then one that separates it from the pulmonary trunk. This is the right atrioventricular valve. Okay. But on the practical, I want you to state this as the tricuspid valve. So this is the tricuspid. It's got three cusps. This is the right semilunar valve. Okay, but on the test, I want you to write pulmonary valve. Other features you notice inside this ventricle, this right ventricle, include the trabeculate carneae, seen as the irregular ridges of the muscle on the ventricular walls. Okay. And extending from them are these papillary muscles that are sort of sausage-shaped. They project into the ventricular cavity, and they from then extend the chordae tendineae, okay, and that's commonly known as heartstrings. But of course, we're taking anatomy, so chordae tendineae is the proper term. And those chordae tendineae are attached to the atrioventricular valve. Moving to the left and posteriorly, we have the left ventricle. As we move the wall, we'll see. Okay, so this is the left lateral view of your heart. You look in, you'll see many of the same features as you see in the right ventricle. We've got the trabeculate carneae, the papillary muscles, and extending from the papillary muscles, we've got the chordae tendineae connected to the atrioventricular valve. And this atrioventricular valve is the mitral or the bicuspid valve. Okay. It's got two cusps. It's set to look like a fish mouth, especially when you look at the valve from above. Okay. So this valve separates your left atrium from the left ventricle. This valve, the aortic valve, separates your left ventricle from the aorta. So internally, dividing the left ventricle from the right ventricle is a septum known by the name of interventricular septum. Hard to visualize here, but there is a similar structure separating your two atria, and that is termed the interatrial septum. Okay. On the surface of the heart, there are a few grooves or sulci. The one that divides your atria from the ventricles, this one is known as the atrioventricular groove. It's also known as the coronary sulcus. Okay. And you can see it extends all the way around the heart. This is your left atrium, left ventricle, right ventricle, and so this coronary sulcus wraps around right here. Okay, it continues here. Around the heart, goes around like that. Okay. Move to the heart back. Now anteriorly, on the surface, on top of that interventricular septum, there's a groove, and there are arteries and veins that run inside that groove. Okay, it's very slight, you can see, but this groove here is known as the interventricular sulcus, anterior interventricular sulcus. So you have one on the back called the posterior interventricular sulcus. This one in the front is the anterior interventricular sulcus. So anterior interventricular sulcus, and then the back of the heart. Okay, so we're not looking at the inferior aspect of your heart. This groove here is also overlying the interventricular septum from the back. So this is the posterior interventricular sulcus. I'll switch back to the slides. So that's what we were just looking at. Here's another image showing the same thing. And we'll learn about those arteries and veins later. But here, make note that the coronary sulcus is synonymous with atrioventricular groove. And this image also illustrates the interatrial septum between the two atria and the interventricular septum between the two ventricles. Okay, now we're going to take a closer look at your heart valves. This is a superior view of your heart with those great vessels cut away. Okay. Whenever you see an image of the heart, the first thing you want to do is orient yourself. And you're going to hear that a lot from me in my videos. Orient yourself. So make sure you know what you're looking at. Is this a superior view? This is a lateral view, anterior view, posterior view, inferior view, etc. So here, this is clearly a superior view. Then you want to figure out what's anterior, what's posterior, what's right, what's left. Well, the way you determine that is, first you look at the center of the structure, okay? And this is going to be the aorta. In the image from previously, you could see that the aorta lies more toward the center of the heart when viewed from above. Right, relative to the pulmonary trunk. So your pulmonary trunk is going to lie anterior to your aorta. So when you're looking at this, you know this is the pulmonary valve, okay, at the base of the pulmonary trunk. This is the aortic valve at the base of your aorta. And you can tell easily that the shape of these semilunar valves are distinctively different than these atrioventricular valves. Okay, so once you determine this is the aortic valve, this is pulmonary valve, okay, then you know this is the patient's left side. This is the patient's right. Okay, separating the right atrium from the right ventricle, we have the tricuspid valve. Separating the left atrium from the left ventricle, we have the bicuspid or the mitral valve. Okay. And from this image, you can actually see at the base of the aorta, just past and just superior to your aortic valve, you'll see the exits or the beginning of your coronary arteries. Okay, there are two, and we'll see this later as well. But this one is the right coronary artery, and this one's the left coronary artery. This is a coronal section of your heart. Okay, you can see comparing your left ventricle to your right ventricle, just how different the thickness of them are. Okay, your left ventricle is on average 3 times as thick as your right ventricle. And that's because your left ventricle has to pump against a higher resistance. Okay, so your systemic circuit is higher resistance. It's a longer circuit. Okay, and in order to overcome that resistance, this chamber needs to be able to generate a greater amount of pressure than the right ventricle. Your right ventricle is only pumping into the pulmonary circuit, which is the lower pressure system. So there is not as much muscle in its wall because of that. Notice in the right atrium, these are the pectinate muscles. Okay, and then in the ventricles, you'll notice trabecular carneae. We've got the papillary muscles connected to the chordae tendineae, and then we've got the atrioventricular valves. Okay. So if you're not sure what is right, what is left, just look at the thickness of the heart. The thicker ventricle is going to be the left ventricle. Okay, and then the thinner ventricle is going to be the right ventricle. And using that information, you can deduce that the atrioventricular valve that's connected to the right ventricle is going to be the tricuspid valve. Whereas the atrioventricular valve connected to the left ventricle is going to be the bicuspid or the mitral valve. Look at how these valves function. When you first take a look at these images, you might think that, wow, it looks so complicated, but really, it all comes down to one idea, and that is that these heart valves open and close in response to pressure changes. Okay. And so whether that's atrioventricular valves or semilunar valves, all 4 valves, they open and close depending on the pressure change across those valves. The atrioventricular valves, which divides the atria for the ventricles, they function to prevent backflow of blood from the ventricle back into the atria during ventricular contraction. And there is a lot of details to the cardiac cycle which you will learn in the next course, physiology. So that's bio 5. Okay. So as you can see, whether it's the tricuspid or the bicuspid valve, the blood, as it builds up in the atria, the pressure inside the atria start to rise until a point that pressure exceeds the pressure inside the ventricles, and that opens up these atrioventricular valves, and then blood then start to fill the ventricles. As the blood start to fill the ventricles, the pressure inside the ventricles start to rise. It rises to a point where the pressure inside the ventricle now exceeds the pressure inside the atria. At this point, those valves will close. Okay. As you can see that the chordae tendineae, okay, these heartstrings, they anchor the cusps of the AV valves to the papillary muscles. And the contraction of these papillary muscles, they're able to hold the valve flaps in a closed position, so to prevent the flaps from everting back into the atria. So as you can see in this image, here the ventricles are just beginning to contract. Okay, as they begin to contract, they push these AV valves closed. Okay, now the ventricles are contracting against closed valves. What that means is the pressure inside the ventricles are rapidly rising. They rise up to a point where the pressure inside the ventricles now exceed the pressure in the aorta and in the pulmonary trunk. At this point, the aortic valve and the pulmonic or pulmonary valve will open up, ejecting blood into the aorta and into the pulmonary trunk, respectively. Okay. So these semilunar valves are shaped differently than the atrioventricular valves. They have a half-moon shape when viewed from above. Okay. Now the blood is going to continue rushing into the aorta and into the pulmonary trunk until a point in which the pressure inside the ventricles now fall below the pressure in the aorta and in the pulmonary trunk. At that point, these valves will close, preventing blood from regurgitating back into the ventricles. As you can see, all these valves, they open and close in response to pressure changes across those valves. Some clinical conditions related to heart valves include incompetent valve, which is where those valves are not closing properly. So in that case, you can get blood being everted back to the previous chamber. So if you have a pulmonary regurgitation, okay, or incompetent pulmonary valve, the blood can regurgitate back into the right ventricle from the pulmonary trunk. Now, if you have a incompetent tricuspid valve, this is when the blood can be regurgitated from the right ventricle back into the right atrium. Similarly with the aortic valve and your bicuspid valve. And the valvular stenosis sounds like the opposite. It is essentially when those valves are not opening properly. Okay. So those stiff flaps oftentimes they're constricting the opening, preventing the valves from opening properly. And so what that means is the heart needs to work harder in order to pump the same amount of blood, because it's now pumping against greater resistance, okay, because of the smaller exit. Okay. These sound like opposite condition, but in reality you can have both. And that is exactly what happens in my foster dog, Benny. He has what's known as pulmonic stenosis with regurgitation. So this valve in his heart, I know this is human anatomy, but it's very similar in dogs apparently. And so he has a stenotic pulmonic valve, okay, which is not opening out properly, but it's also not closing properly. Okay, so there is actually that I've been told by his cardiologist that they cannot really, he doesn't have a very good prognosis, because they could do a surgery to open up the valve, but then that could improve the stenosis, but then worsen the regurgitation. Okay, so his valve is not opening properly, but also not closing properly. And so when they did an echocardiogram, which is imaging done on his heart, they saw a markedly enlarged right ventricle, because his right ventricle has had to work harder than usual to pump against that pulmonary stenosis. Okay, so he has a huge right ventricle. And your heart may be able to compensate initially by working harder, but over time, that increased heart load is going to place your heart under immense amount of stress, and then whether it's human or dog, eventually can go into heart failure as a result.